If I make someone proportional for their body, they can always like change their clothes. Like clothes should be trendy. Like you can donate those and go buy more. You can't donate your body and go get a new one, okay?
Yeah. Hey friends, welcome to Keep It Simple Sexy. I'm Christine Bullock, founder of KO Body Care, certified fitness trainer and mom of 2 little girls who's just trying to juggle it all and feel as good as possible. I'm so grateful that you're here. Now let's get started, sexy. Hello, beauties. How is your day going? I'm your host, Christine Bullock, and welcome back to Keep It Simple Sexy. So, speaking of, I'm staring at myself in this video chat right now because, not only are we podcast, but we are on YouTube if you ever want to watch the video. But how many of us have been hyper-analyzing our facial angles on Zoom and social media? Me, a little bit, okay? I'm going to be truthful. With our former lockdown, video calls have become a mainstay, and pandemic-era cosmetic procedures continue to rise, and they're going to surprise a little bit. The cosmetic industry is booming, period. In fact, according to the Aesthetic Society, Americans spent more than $8.7 billion on aesthetic plastic surgery in just the first half of 2021. So, what is everybody having done? Because people are looking pretty good. I've asked Dr. Sheila Nazarian, top Beverly Hills plastic surgeon, to give us the tea on how we too, if we choose to, can look like an ageist celeb or a curvy influencer and what exactly they are getting done. And beyond plastic trends, Dr. Nazarian always has the newest and best high-tech anti-aging devices that can actually help you avoid going under the knife. Dr. Sheila Nazarian is an Emmy-nominated, board-certified plastic surgeon with a private practice in Beverly Hills. She has a master's in medical management from the Marshall School of Business in USC. She's also serves as an assistant professor in Division of Plastic Surgery at the University of Southern California. She's the founder of Nazarian Plastic Surgery, Spa 26, the Skin Spot e-commerce site where you can pick up a lot of really great skincare that she recommends, and the Nazarian Institute, where she brings thought leaders to teach business owners in the luxury space to think big. It's about branding, innovation, growth. Dr. Nazarian is the star of Emmy-nominated Netflix original series Skin Decision Before and After, and she's married to one of our top LA neurosurgeons, Dr. Fardad Moben, and she has 3 beautiful, smart, sweet children. Welcome to the show, Dr. Nazarian.
Yay! Thanks for having me. Good to see you, even if it's virtual.
I know. Good to see you too. Looking gorgeous as always. When
Oh my God! I dropped off the kids, went over all the stuff with my assistant of the to-dos for the week, and I'm here. We made it.
I was actually thinking that too, because I'm single momming it this week too. Bob's in trial, and I was dropping Remy off, and I had to stay there for a second. And as I was driving back, running in, I was thinking of you. I was like, so many years ago. Oh my God, it was so many years ago. We were shooting it was like an old show before your Emmy nominated show. Congratulations, by the way. And I remember you leaving the shoot.
Yeah.
To then go pick up your kids, to go back to your house from the office to shoot again. And I was like, see, Sheila's fine with it. She's probably dropping off her kids too. She does it all, people. She's smart, educated, beautiful, great mommy. She does it all.
We try. We're all trying.
You really put in your research. And this is why I wanted Sheila on here too, to really preface this. Yes, you're amazing at plastic surgery and you know what's going on, what you want to do, what you don't want to do. And I hear the questions all the time from so many people of just even where to start with that. And even we'll maybe talk a little bit about what to know when you go into a consult too. Yeah. But you always have the top newness out there and high-tech gear. And it's not something that it's trusted and true. It's going to work in the long run too. It's not going to end up doing something to you in the long run as well. You know what I mean? Yeah. You have the good stuff, the new stuff, but you get the science of it. So I'm excited to bring all your wisdom to everybody today.
Yeah, no. And I kind of want to preface it too by saying this is all about I always say, like, you know, I'm getting my, like, the bag under this eye is getting a kind of like a situation versus this one. But is it like, do I want to do anything about it right now? Like, I always say, you know, our brains, our hearts, our souls, our core values are who we really are. And everything we want to do on the outside is kind of self-care and a cherry on top. So I want to just preface everything by saying, like, yes, I work in the beauty space, and yes, I'm a plastic surgeon, but really it's about making sure people are whole kind of in a holistic way, rather than just being like, yeah, sure, come in, I'll make your boobs bigger. You know, like, I don't know. I also, like, I think the beauty, the true beauty comes from happiness. And as we all know, that is a very multifactorial thing, including purpose and including being in touch with your core values, finding your voice and using your voice. So these are the kinds of things I think that's really what I do is about. It's not about making your skin glow, which is great, but really it's about giving you that confidence to use your voice and to, you know, like, find your purpose, rather than just like, oh yeah, we're discussing like devices today.
Yeah, which you do yourself. I mean,
Yeah,
you know,
I
you're
do.
very,
And I try
very public
everything on
speaker in
myself.
so many different ways, politically, religiously, all that kind of stuff, you know,
Yeah.
and you do what you can. I mean, business wise, as well as a businesswoman with your ThinkBIG, she's had from oh my gosh, Bethany Frankel to the Queen Kardashian, Kris Jenner herself. Yeah.
No, and it's just all about, like, we're all like, even those people, you know, we're all kind of like in the same struggle. We need to look our best, feel our best, but those women are hustlers. Like, those women are doing it all as well. And so I think it's really cool and inspiring just to, first of all, like, the things that we're doing, we're like, okay, like, we're doing that right. Like, you know, being amongst like-minded people and being like, okay, yeah, she's doing that too. Or like, yeah, I went through that evolution too. And it's, but then also being like, oh, I never thought of that. Or, oh, wow.
It's emotional growth too.
Yeah,
business
100%.
and emotional growth. Yeah. And you know what? Look, I'm just going to say it. When you wake up and you look a little bit more refreshed, it is truly easier to jump into your day. And you all know what I'm talking about.
Yeah. Nothing wrong with that. And the thing too is, I don't consider it vanity. I consider it self-care. Like, you take a bubble bath, you stretch, you get rid of your wrinkles. Like, I literally, like, look at all of that on all the same spectrum.
Amen, sister. That's the quote. Yeah, you eat well and you get rid of your wrinkles. All right, well, let's dive into it. So what are the top trends in plastics for face and for body going on in 2022? And, like, which is bigger right now too, face or body?
I would say, like, during the last 2 years, it's kind of like everything's gone up, because I think people, I think it's two things, actually three things. I think people weren't traveling. And so they're like, why do I need to buy clothes? They didn't have the travel spending, like, expenditures. And they were just like, okay, I have some income. Then cross that with being on Zoom and this nice little angle coming right up into the neck area and the jowls. And that was a big thing. And people are like, holy shit. Like, what happened here? So it was just like, almost like a pause where people were refocused on their health. And I think it was also like during that time where everybody was like, death was like a real thing, right? And people were kind of faced with their own mortality and like, life is short and I want to spend my life. Like, why am I working so hard when I already have this house and my kids are old all of a sudden? Like, I totally missed like their toddler years. So I think people were also like, what do I need to do for me to feel my best? And what are my priorities? And I think it was, you know, life is short was kind of like a thing. And so people really kind of looked inward and were like, what do I want to do to feel my best and live my best life? Because, you know, it can be taken at any time. Which is kind of morbid, but I really do think that was a factor. And there's actually been studies on that. So I think it was a combination of all those three things where people were really like, this has always been bothering me. I don't need to live this way. I'm not traveling and I'm not buying clothes. So I have like the funds for it now. And I'm working from home. So people won't even realize I'm recovering from anything and I can continue to work while I'm recovering. So it was like the perfect storm. So everything's gone up as a result of COVID. But I would say with the face, it really has been a lot of lower face. I always like say I've never done so many facelifts in my life, but also there's like Face Tight, which is a radiofrequency in-office treatment that gives awesome results for someone that's kind of like mild to moderate laxity. There's Morpheus 8, which is a microneedling radiofrequency device that is really good for like, you know, tightening up pores, even killing fat. If you drive those needles and buzz in the fat, it'll melt that fat. So there's just so many cool like technologies that actually work now. It's really about, my job is to make the correct diagnosis and treatment. So if somebody, just put it to you, like let's say somebody comes in and they have high blood pressure, the doctor is not going to give them diabetes medication, right? Because that's not the correct treatment for that diagnosis. So it's very much the same with anatomy when it comes to aesthetics. You make the correct diagnosis and you apply the correct treatment for it. So it might be a needling, it might be a minimally invasive procedure, or it might be surgery, depending on what it is that that person needs. So I would say for the face, it's really been lower face because of the camera angle of Zoom. For the body, it's been a lot of body contouring, and there have been huge advances in body contouring that lower the risk and improve the result. So, for example, we brought on Vaser, which is a technology that they were like knocking down my door for so many years, and you know that my office manager was like, "Full stop, don't have access to Dr. Nazarian." But when I finally brought it on, it was a game changer because this device actually goes in prior to lipo and vibrates at 30,000 times per second at the tip. And those really stubborn fat cells, like your love handle fat is thicker than your like stomach pooch. Like, so I always say, imagine your fat is like really strong monkeys holding onto tree branches, and those tree branches are your collagen fibers. And they don't want to let go. The strong monkeys don't want to let go. And it's really hard to lose weight. Those are the areas that like, oh my God, I would have to like starve myself and work out 4 hours a day for this to go away. Those types of areas.
Yeah, I was going to say, can we break into it just a little bit so people understand who are very novice about this? Is because I get this from the fitness side all the time, is that like, how do I get rid of the little thigh patch, the, you know, the waist, what you're saying, the love handles, but it's hard, stubborn fat. It's full of toxicity usually. And it's like diet and exercise, exactly what you're saying, are going to help you to lose it all over.
Yes.
But it's almost like it needs support. It needs to break up. It needs to massage. It needs to shake it up, like what the Vaso something or other is doing.
Right. And people have to also understand you're born genetically with a certain number of fat cells in certain areas. So some people will gain weight in their thighs. You are actually born with more fat cells in your thighs. So by removing those fat cells or reducing those fat cells, now when you gain weight, you're going to gain it more uniformly over your entire body rather than just feeling like you're gaining it in the stomach pooch or in your love handles. So that's a question I always get asked too. If I liposuction here, am I going to gain weight someplace else? And that's not how it works either. So imagine you're born with like storage units. You know, the storage units that like you put your old furniture in? Okay. So think of fat cells as storage units. If you have more storage units around your midsection, when you eat fat, when you take in those calories, they're just going to expand. The storage units that you have. You don't have as many storage units on your wrists. You don't have as many storage units on your ankles, right? So you're going to expand and shrink the storage units that you have. Now with liposuction or cool sculpting or the other, you know, types of methodologies that get rid of storage units or fat cells, you're just shrinking that area. So now when you gain weight, you're going to gain it more uniformly because you don't have more storage units in one particular area. Now, with that said, you should try to keep, you know, a good lifestyle so that you don't gain a lot of weight after liposuction. You want to be within 15 pounds of a weight that's goal. And by goal, I mean that you can actually maintain. People try to lose weight and they come in for liposuction and you do it based on that body. And then they go back to their old lifestyle and they gain weight and they're like, yeah. So just
it's like their workout
weight that you can maintain that's healthy for you and then come in to see us.
For body contouring too, is it just liposuction, that kind of stuff? Is cool sculpting still a big thing? Is it the injectables too? You know, what's going on?
So let's go through
like
that
body contouring is like, you know,
let's go through everything. So the injectables, like Kybella deoxycholic acid, it's a bile enzyme. So when you eat a cake and your gallbladder squeezes bile into your stomach, it's deoxycholic acid that's breaking down that fat from the cake and, you know, going into our bodies. So this is a synthetic deoxycholic acid. And I found for Kybella, the areas where you want to use it the most are very small pockets of fat. So almost like my neck, like this would be great for Kybella. If it's more than that, awake lipo. But sometimes people come in and they, you know, don't have time for it. Or I've even like put 8 vials of Kybella into my stomach when I can't lipo myself.
Yeah.
And it was just a little bit of like a little donut around my belly button. So I shrunk that sucker down with Kybella just in my office. I just shot myself up.
How long does it take to work? Shrink it all down?
I would say like about 2 months is kind of when it's swollen, the bruising's gone away, and the debris from the, you know, burst fat cells has been kind of cleared out effectively. So you can always retreat at 2 months as well. But cost, and like you swell like a mofo. So you don't want to be like, oh, okay, I'm going to do my love handles and I'm going to undergo 20 sessions of Kybella and I'll look good like 3 years from now because I have to wait 2 months and then I wasted all this money and you know, and I got swollen, not swollen, swollen, not swollen every 2 months. Like, you know what I'm saying? If it's like a little thing and it's like 2 to 3 sessions is going to take care of it. Yeah. Great. That's a good choice. Otherwise, lipo. And then when I say lipo, I'm talking Vaser, I'm talking skin tightening with a radio frequency technology. We have 2 of them depending on age. So that's Body Tight or Renuvion or J Plasma, it used to be called. And then also power assisted liposuction, which the actual lipo device is vibrating to not make our hands fatigue so that we can keep going and really do a thorough job. So I'm just saying, like, if you just go and you're getting lipo, and they call it all funny things, they'll call it like air sculpting or like there's all these like marketing names, but really it's just lipo. And it can be done awake for small areas, and it can be done, you know, obviously asleep for thicker fat or larger areas.
And then what about the injectables? But I also mean like people, I mean, I know so many girls in LA are getting their butts done. I just want to say too, like it is actually a really big trend for the influencers that people are seeing some of the top. It's just, I want them to be aware that like nothing's truly so perfect and that.
Yeah. You know, so with the butt, I've been seeing like, I do like, so you guys, I have to preface this again. Lots of prefacing, but I do like only natural results. So if there's a trend, great. When that trend goes away, those people are like screwed. But I just say, like, if I make someone proportional for their body, they can always like change their clothes. Like clothes should be trendy. Like you can donate those and go buy more. You can't donate your body and go get a new one. Okay. Yeah. So also I always use like a couch analogy. When you get a designer to come to your house and do a couch, they use a neutral couch and you change the pillows. You don't get like a freaking orange and yellow and green paisley couch that's on trend for that like minute, right? Yeah. So I'm always looking for some symmetry. I'm looking for proportions. I'm looking at their breast size, their waist size, their butt size, their thigh size, and just making sure everything makes sense and giving them a healthy athletic, you know, not like uber athletic, just like a soft, like just shadows and, you know, like suggesting athleticism and health and, you know, they're thriving. So that's the sort of my aesthetic and why people come to me. So yeah, no, I'll do fat injections, but again, small volume, symmetry, lift.
How long does it, how long does that last for? What if you start burning fat?
The fat cells, again, fat's stupid. It doesn't know if it was in your love handles, your stomach, or if it's in your butt, your boobs. So if you eat, it's going to expand. And if you diet, it's going to shrink. So about 50 to 70% of what's injected will live permanently. And those are, again, storage units. So you can expand the storage units or shrink the storage units based on what your intake is.
And you have to take it from the individual too.
Right. You can't like give it to a friend. But there is a product called Renova that's FDA cleared actually for the whole body. And that is a honeycomb matrix of like irradiated fat cells that were taken from other people. And when it's injected, it acts almost like the scaffolding of fat, and your body will actually fill it with your own fat and collagen. So I like to use that for butts now, and you can even use it for lumpectomy after breast cancer. Like it's FDA cleared. When I say for the whole body, it's the whole body. And so I'll mix that with Sculptra, which is also biostimulatory, meaning it builds your own collagen when it's injected, and also Radiesse, which is also biostimulatory. So I have this mix that we do the non-surgical butts with, and people will come in. Again, this is probably the most expensive thing because all of these products are buying off the shelf. So I always say, if you have your own fat, use your own fat first, and then you can add on. But some people don't have any fat, like literally don't have fat and don't have any butt. So this is a great option, whereas before there'd be no option, or butt implants, which I don't like.
Good to know. I love it all. The Keep It Simple Sexy podcast is brought to you by KO Body Care. Right after I turned 30, something happened that I was not expecting. I noticed the skin on my body was aging faster than the skin on my face. Crepiness, sunspots, fine lines, and wrinkles, they all seemed to creep up overnight. And then it hit me. I'd been using all sorts of powerful anti-aging ingredients on my face, but I wasn't doing the same for the skin on my body. So that's when I had that aha moment to create KO Body Care. KO is face-grade body care, which means that it's pure and effective enough for the face, but formulated just for the body. We use the same ingredients as high-end clean skincare brands to help skin look smoother, brighter, firmer, and younger. The product that put us on the map was our Body Beautiful Cream. Beauty editors are obsessed with it because it combines clean, natural ingredients, omega oils, green tea, mangosteen, goji berry with clinical actives like hyaluronic acid and CoQ10. It leaves the skin feeling so hydrated, so smooth, so soft, and even gives your collagen production a boost. So are you ready to see what face-grade body care can do for you? Then go to kobodycare.com. For our first-time users, use the special code KISS20 for 20% off your purchase. The liposuction, I'm kind of thinking arms too, because these were like older issues. I mean, in the sense of what was going on with liposuction like a decade ago, what I used to see. But you're just doing, this would go for anywhere. So you're doing skin tightening afterwards?
So you guys, there's
to help
two
smooth
places
and all that? Yeah.
Yeah, there's two, maybe even like a soft three places that I will not just do plain lipo without heat. One of them is the inner thighs. The inner thighs, that skin is thin. You lipo that, you're going to look like drapery. So inner thighs, must always do it with heat. And I mean radio frequency heat. So body tighten it all up. Same with the arms. So before, when you deflate the arms, you can get actually like
the skin,
the little
there's no muscle or anything.
So you want to put heat in the arms too. So those two places are non-negotiable. I will not do lipo without putting in heat, because you want to like saran wrap that skin in. Nobody wants to take away the fat and then be left with another problem, which is like a flap of skin hanging. And then also the neck. So a lot of times now when I do liposuction on the neck, if it's above the age of 40 and maybe even sometimes even younger, I will put in the heat just to make sure that's like, nobody wants a little flap of skin.
Yeah. I mean, literally left with something else after treating one thing, because you've taken up that space. What about, is it Cool Sculpting? What is the machine that ices it out, that freezes it out? I've been sitting in my house for too many years. Are you still using that?
Yeah, we are. So I'll tell you again, you guys, it's all about going to someone who knows what the heck they're doing and who has multiple things to offer you, because I've seen so many women with just like post-pregnancy with just like skin hanging, and they go to some med spa and they're like, yeah, we'll Cool Sculpt that. It's just skin. Like that person needs a tummy tuck. Like it's not going to work. And so you really have to go to someone that not just has Cool Sculpting, but also has minimally invasive surgery, microneedling, radio frequency, and surgery, so that they can actually, there's no like, nothing pushing them to offer you one thing. Like when you only have a hammer, everything's a nail, right? So you want to go to someone that has everything to offer you, so they can actually give you what's good for you. So I would say it works, but it has to be the right patient. It's just like making the correct diagnosis and applying the correct treatment.
Yeah. In the right area. Exactly. Right area, right patient, right fat.
Right. Right. And I'll tell you, like, I've been doing Cool Sculpting for so many years. I would say even like 7 or 8 years, like since it came out. And I find that it works much better on fluffy fat. So like if you grab I'm pigmented, right? If you grab my fat, it's going to be a lot thicker than what Christine has no fat, but let's say she did. So her fat would be a lot
6.5 months pregnant, girl. Trust me.
So it works better on like fluffy fat that you can, like, it's soft. Like when you grab my fat, it's like grabbing like a tufted couch, like it's hard, And so lipo would work better for me. But typically lighter skin types tend to have less collagen interweaved in their fat. And so it's fluffier fat, and Cool Sculpting does better with that type of fat.
Ah, interesting. Just going to get better results too.
Yeah, and I don't want people writing
it.
bad reviews. I want everyone to be happy and send their friends, right? So that's when I look at a patient, I'm like, what's going to get them to goal in their budget, in their timeline?
Yeah. Love it. Oh my gosh. That was the tea on all the body stuff, which I love to hear about. You know, because I do believe, you know, for everybody out there, yeah, I'm a wellness gal, and we can do so much. We can, exactly what you're saying, Dr. Nazarian, eat well, have the lifestyle, stress, cortisol levels, do the workouts. But you know what? Our bodies are our bodies. Our life is our life. We deal with these things. And if you want to do something about them, and you can, I don't see why not, as long as you're in the hands of an expert. So that's the dish on the body. Let's get to the face a little bit. We're going to get to the other high-tech devices too. But I really need to know myself in my 40s now. So I'm not being able to do anything because I'm pregnant. It's like, But okay, so people are doing the lower facelift. So what's the difference? I want to know the facelifts. And for the viewers, I used to go into facelifts and like eyebrow lifts. I want to know how it's changed a little bit, because before it was like, I mean, even before me, but I've seen it, a full incision, ear to ear, pulling the full scalp back. Then they started to do tiny little incisions for the eyebrows and for the jawline. And then the difference between like that, which seems way more invasive than the thread lift, which I have heard every makeup artist I talk to tells me that, every celeb, every reality star, everybody's doing it or has had it done. I've heard of 20-year-old influencers having it done. And the problem is, and I'm just going to break into the thread part, I've heard so many mixed reviews. People saying it's beautiful, it looks great, to people saying it's hurt them for an entire year afterwards, been painful, or having like dimples underneath the skin in certain areas. So give me the down low on all of this.
Okay, so let's attack the threads issue, the threading first. So I offer threading, and I think we have to also really like look on the back end, like the dark side of it a little bit. So there's 4 things that you're going to hear about the most on social media, internet, and it's because every practitioner can afford to get their hands on them. So every practitioner can afford to get their hands on neurotoxin, like Botox. Every practitioner can get their hands on filler. Every practitioner can get their hands on a simple microneedling device. Not a microneedling radio frequency device, but just plain old microneedling pen. And every practitioner can get their hands on threads, just because the cost to entry is very low. Okay. So let's say a microneedling pen costs about like $3,000 for us to get. Botox costs about $600 to $700 a vial for us to get. Filler costs about $200 to $250 a syringe for us to buy. And threads might be $100, $150 for a box of threads. So that's what everyone can get their hands on. And so you're going to hear about it the most. Okay. With contrast, my cheapest device started at $120,000.
Yeah.
And I have 30 devices.
Yeah.
Okay.
The least expensive. Yeah.
So just so you understand, you're going to hear about a lot of things, and it might be that
because people are going to, those doctors and physicians are going to market it because they can afford to do that for you, and they need to make their money up.
Assistants, everyone can market those things because everyone can get their hands on them. Doesn't mean they're best, but it just means a lot of people can get their hands on them. Okay. So I think that threads, if you have nothing else to offer a patient, might be fine. In my experience, it works and looks okay for about 3 months. They will tout a year, that it looks great for a year. I like the sort of sugar threads, the ones that will like promote collagen, like Sculptra does. Sculptra would do the same thing. The ones where you can see them kind of mesh like that. They're not lifting anything. They're just threads placed under the skin. And as they dissolve, your body will build collagen around them. Those I like. But you can also just get Sculptra and they'll do the same thing. Okay. the lifting threads, the barbed threads, which is what you're talking about, that can dimple, that can cause pain, and they tout to last a year, won't. It'll last about 3 months, and then you get unhappy patients coming in,
either it's not worth it,
asking for their money back or asking for more free threads. And the downtime for threads is 2 weeks because you can bruise. It is a whole freaking thing that's going in your face. Every time a needle goes in your face, you can bruise. So the way I think about it, I could do a face tight procedure that gives a 5-year result that has the same amount of downtime, is predictable. Patients are predictably happy.
What's a face tight procedure? Like a laser or an actual surgery?
I have a million videos on all this stuff, by the way.
Yeah,
guys.
I know. You have to go to her YouTube. Well,
YouTube
or on your website, because they're both. Tell them where to find them right now. What's your website and what's your YouTube?
So NazarianPlasticSurgery.com is our website. YouTube is also Nazarian Plastic Surgery. And then on Instagram, the Model Surgeon, we will literally post live ass surgeries. So you can like be eating your breakfast and watching a tummy
You will
tuck.
sometimes get warning videos like, do you want to watch this? And I'm like, yep, click.
Yeah. I call them my surgery sickos. I'm like, because you guys
it.
have to be ill to want to watch these, but it's okay.
No.
I think it's like behind the veil of the Wizard of Oz, you know, like you can see what's actually going to happen to you. But if you get grossed out, don't go that one.
Yeah.
So I think, like, you know, face tight is 3 pokes. So one behind your like jawline, one underneath your chin here, and another one behind your jawline. And then I'll numb you awake. And there's a million videos. It's literally not painful at all. And then I'll go in and do a little bit of facial lipo, neck lipo, really chisel out the jawline, and then put in that radio frequency heat. It sounds like snap, crackle, pop, like bacon cooking.
Inside, you're putting it
underneath
inside.
the skin. Yeah. And it's literally 90% of my patients I do this to are awake. The only reason why the 10% are asleep is because I'm also doing their tummy tuck, or I'm also doing their breast augmentation at the same time. And that continues. You get an immediate like Marie Kondo, like spark joy, because the fat and the jowling is gone from the facial lipo. But it takes about 10 to 12 months for you to like really see the full skin tightening. So it's just constantly getting better and better and better and better. Even though you were happy at 2 weeks after, you're just like, the happiness continues. And then it lasts at least 5 years, maybe longer.
Do you feel like it looks like what some of the people are doing with this needling, I guess, or the threading?
I think it looks better. Because there's no dimpling, there's no like pain, it's predictable, and the threads don't take away the fat. The threads are just sort of doing this. Yeah, and then they're gonna for like a second, and then it drops back down. How do you expect a thread to hold up your freaking face when you're moving around all the time? And like, it just can't.
Yeah, right? Common sense.
And sometimes people are using threads to hold up people's butts. I'm like, this is stupid. This is crazy. They were doing it in the boobs, like through and through from the bottom and pulling it up. And yeah, it'll hold for about 5 minutes. But gravity.
Can you imagine the pain of that with with these like tiny little spikes poking different places when you pull,
horrid. Yeah. And so I just, technology is technology. Yeah. And if that's all you can get your hands on, that's all you can get your hands on. And can threads occasionally give a great result? Yeah, occasionally. I'm not in the occasional business. Like, people are like flying out to see me to get that vision in their head that they imagined all along. And so if they fly out and are staying in LA, for a minute to see me, I better deliver. And so I'm constantly looking for stuff that just is predictable, is safe, and delivers. That's my reputation on the line. So I have fillers in the office just to like hold the box and be like, see, I have it, but here's a better alternative. Let's like, here's what we're actually going to do. Yeah.
What about the eyes then too, for the eye? Because people are
for the eyes,
what are you recommending here to like open up
I
through the side eyebrow
line? Yeah, I will do a lateral brow lift awake. And there's also, again,
videos you're doing it awake now.
I do it 90% of the time awake, unless, again, I'm doing a facelift or unless I'm doing something else that requires them to be asleep. But the brow lift, again, I have tons of videos. Go watch it. We're like literally talking about their prom. Like we're going back down memory lane and like just having a full blown conversation and becoming best friends while I'm lifting their brows.
People are on a little bit of meds for that. Yeah.
No meds. Christine, it's literally 5 ml of lidocaine. It's literally 5 ml of lidocaine. Like, you've probably had a dental procedure that required more lidocaine. Okay. I'm telling you, there's videos.
No, I know.
Go watch the videos.
Even dental work, that gives me hyperventilation.
Yeah, dental work is worse. Like, honestly, that pain, because it's like nerve pain, is a million times worse.
Yeah, that's
this
the worst
is
in
nothing. It's literally like numbing to sew up a cut.
Yeah. Oh, okay. Amazing.
Yeah. It's like nothing.
Can do. Okay.
Yeah.
A glass of wine or tequila beforehand, guys.
No wine.
Just kidding. Just kidding. She's not recommending that. Yeah.
Don't make me bleed. Don't do that.
I know. No, don't. Water. Lots of water.
Mm-hmm.
Okay. So we hit the plastic surgery trends. I want to hit on the high tech, but first I feel like, having worked with plastic surgeons for so long, one of the biggest questions I get from my girlfriends is like, how do I find a plastic surgeon? I mean, obviously you want to go to Dr. Nazarian first, but if you're not here or don't want to fly out, what should you look for in a qualified plastic surgeon? And, what should you do in the process of interviewing them? Is there anything specific?
That's a great question. So I think what a lot of people now are practicing the art of plastic surgery, but actually had no training in plastic surgery. They might be general surgeons. They might be OBGYNs. I even know an ophthalmologist that's doing breast augmentations and tummy tucks. So if you, and you might like their results and be like, I want an ophthalmologist to do my boobs. I mean, it's up to you, but at least you should be informed as to what you're getting. Yeah. So I think the most common question people ask is, are you board certified? And they'll say yes, because they're board certified in OBGYN. Or they're board certified in general surgery. So they could say, yes, I'm board certified, right? But they didn't really answer your question. And then also there's like a fake board called the Board of Cosmetic Surgeons, which is not a recognized board, but all of these like wannabe plastic surgeons will do like an online fellowship with this fake board certified cosmetic surgeon board. And they'll get like a plaque that looks like ours. But, and they'll be like, oh yeah, we only do cosmetic surgery. We're like Uber certified more than the plastic surgeons because they also do reconstruction. We're like focused on cosmetics, but really the way you want to look at it is like, we have training. Like I can reconstruct a breast from nothing. Doing your breast augmentation is like not anywhere near as hard as that. So yeah, it's almost like having a really broad base of training and then specializing. So we look like this, whereas they have no training and they're doing all of these plastic surgery procedures. So they look like that. Yeah. So, you know, we want to have someone that has a really nice core training and then subspecialized into whatever they want to do. So the question you want to ask is, what did you do your residency in? What was your residency training? Can I see your residency training diploma? Okay.
And then what do they want to look for? Plastic surgery. Okay.
Because if their residency diploma says general surgery, now you know they're a general surgeon that's doing plastic surgery. Or if it says dermatology, you know they're a dermatologist doing plastic surgery. Whatever it is. And you might still want to go to that person. That's fine. But at least do your research and know what that person was trained in. Yeah.
Absolutely. I mean, I want somebody who, in case something happens too, or they find something as they're going in, especially with surgery, that really has an understanding of deep stuff, because you don't know what's going on underneath of it. Even if it is a breast, if it's an arm, if it's a, you know, a face, what's going on, what they're going to find underneath.
Right.
Or and that's something something could happen too. Yeah.
Like when I was so trained. When I was speaking in OBGYN, I literally went to all the anesthesiologists in my hospital and I said, who does the best crash C-section? Because anyone can catch a baby. Who does the best
on call with this one? Just in case.
Well, I know. And they all pointed to one guy and they said, that guy delivered all of our kids. Because they're the anesthesiologists are the ones that are, you know, they're behind that. They know. And so that's what I did. I want to know someone that can handle a complication. That's the difference between broad training and no training.
I love it. And then, I mean, I guess I'll just know that and know that you're comfortable. See the before and afters. Ask
100%. Make sure the aesthetic matches. Make sure that they're also, the other thing too is, you know, on the plastic surgery and branding side, I always say you're going to attract what you put out there. So if I put out massive breasts or massive butts, that's what I'm going to attract. And I don't do that. I'm known as the small breast queen. I only put in small breast implants. So people will fly in from Norway. People will fly in from Sweden. People will fly in from all over the country because they know I'm not going to shove a massive implant into their small frame. And I'm not going to push them to do so. If anything, I'm like, go with the smallest implant that you like can bear, because that's, you're resetting your baseline here. You can always change your bra and look bigger. You can't change your bra and look smaller. So don't be in the mindset of how big do I want to go? Think of where do I want to reset my baseline?
Yeah, which I just read too, that the trend, one of the trends of 2022 is actual reduction and just like fixing augmentation. But this is like 10 years ago, people were doing this because they were so crazy looking that everybody was reducing. And
that's where we get back to the
yeah.
proportions, right?
Yeah,
if they just would have done what fits their body every 10 years, they're not like getting another surgery.
Right. And you don't have to do a little bit more chop of the skin too, even if for whatever reason you had babies and you want to fill it in a little bit more. You don't need so much. I'm down with the tiny titties.
Yeah,
excuse me.
It's so in right now anyway. I always tell my patients, I don't want you sagging. I want you to wear a bonbon jacket with no bra.
Ooh, I like it. Okay,
there you go. Them like look like
my goal is so cute. And then boosting it up with a little Dolce & Gabbana underwire, right?
Oh yes, the little corset. Yes. Love it.
Okay, so let's talk then. I think we've hit on so many things. I hope you guys are really enjoying this one because I hear these questions all the time. How about all your new devices? I guess, can we hit on melasma first and then maybe we can talk about some of the other stuff just because it is so prevalent nowadays. And I've gone to you for melasma before. We did the halo.
You're like one of our like queen before and afters for melasma.
I'm coming back in after this baby, to be honest.
Yes.
It's back again, but I cannot wait. But tell me what's working now. I mean, I think halo is still probably really good, right?
Yeah, it depends on your skin type. So if you're a lighter skin type like Christine, I like Halo BBL. It wipes that shit out. And then we just put you on the proper skincare products. And our hero products on theSkinspot.com are Suspera, which is cysteamine, which is really high in breast milk. It smells bad, but it works really well. So Suspera is a great maintenance product. Hydroquinone pads are also a great maintenance product once you've cleared it, but they do make you more sun sensitive. And you can't use it year round. So that's another option. And then also, we have other like a retinol, kojic acid, hydroquinone cream that we have in the office that we might put people on. But Suspera is a safe one. It's non-toxic, and that's one you can use all year round.
Oh, can you use it when you're pregnant?
Well, they haven't done studies on pregnant people, but it's really cysteamine. So I don't know if you guys have heard this like old wives' tale, like if you start to get melasma, get your breast milk and put it on it's because of the cysteamine in breast milk.
Ah, nice. Okay.
Right? Yeah. So would I probably use it? I probably would.
I know, me too.
But we're not recommending for me, but like no doctor is gonna like I would do a lot of stuff to myself that I might not like,
Me too.
Yeah, there you go. You know what and also you can just ask your OBGYN too. Like you can take the ingredients and show it to your OBGYN. They might be like, it's fine. Also, a lot of this stuff like retinol, just between us girls.
Yeah.
Like if you're using a retinol, the actual like blood levels of retinol from you applying, they say like don't use retinol while you're pregnant, but like the actual like amount going into your bloodstream is like negligible. But no doctor wants to take the liability, so no one's gonna say don't do it.
I would say I feel like eating, sorry to everybody out there, but like a McDonald's regularly or anything like that probably is a little bit more than some of the other things that we're thinking of in the sense of health and wellness. Okay.
Or like just like
soda. You're chowing down on McDonald's every day, but
there's just like you just do your best, I feel like. But again, like for us, they say no alcohol. In Europe, they're having a glass of wine a day while they're pregnant, and everything seems to be fine. Yeah, so it's just sort of like I feel like it's conversation between you and your doctor, and also how you feel, what you feel comfortable with.
Yeah.
So I would say that for lighter skin individuals, it really is Halo BBL still. And then for darker individuals or even lighter individuals, we have a power peel, which is basically a high dose hydroquinone, retinol, kojic mix. And you put it on, it's a face mask that you leave on for about 6 hours. And then it has an at-home bit that you also continue for a month. So for darker individuals, if we do an aggressive Halo BBL, it's heat. And dark people, when you apply heat to their skin, we actually hyperpigment worse. Whereas white people, you can burn their faces off and they're like, I look amazing. But us, we have to be careful. And the darker skin really does behave differently. And I'm a darker skin person. So that's why I try a lot of things on myself first. I'd rather try it on me than use my patients as guinea pigs. Yeah. So, and I've done the power peel, works awesome. And it really is it was developed in Spain, and it's made for darker skinned individuals with hyperpigmentation, and specifically melasma.
Nice. Okay. Done and done. I'm in high August. I'll be in it late September or late August, actually.
We'll see you then.
As soon as this baby is out. Okay. So what else is going on for like what just devices do you love right now? I mean, you could talk about anything, face, body. I don't care.
Yeah. I mean, I really
what do I need in my 40s?
Oh my God, what do we all need in our 40s? I think, like, for me personally, I think weight maintenance and weight loss has just become a whole different beast in my 40s. And I remember being in my 30s and hearing my patients talk about it. And I was just like, it's just conservation of mass. Like, if you don't intake the calories, you won't gain weight. Like, what? And then now I'm like, oh my God, why are my thighs touching?
I feel.
Yeah, you know what I mean? And I know Christine has had her, struggles just like
PCOS, hormones.
Yeah, exactly.
I know, I get it. You look at something, you gain weight. Yeah.
Yeah, exactly. I feel like I breathe it in and I gain weight now. Whereas before I was like literally trying to gain weight. Now I'm like, okay, I tried intermittent fasting. I'm drinking the bone broth. Like, what do I need to do? So I just think it has become a whole other beast. And it's really about just trying to like figure it out. It's almost like getting a new body and trying to figure out what worked for you in your 20s and 30s might not work for you. Like, you might have to eat more to lose weight in your 40s. But what is it that you're eating? What's the timing of that? And, you kind of like have to relearn what your body will be agreeable to and what it won't be. But yeah, I mean, as far as devices go, we love our microneedling radio frequency. Morpheus 8 has been a workhorse in our practice. I literally am chaining myself to the spa bed once a month for 3 hours. I'm laser hair removing. I am doing the microneedling radio frequency Morpheus 8 on my anterior thighs because those are starting to ripple. That's a new thing. I'm doing it to my stomach because that's starting to ripple. That's a new thing. And I would just literally numb myself and stand in the mirror and just bzz, 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 like go into my own skin. The other things I love are Vivace for the face, which is a different microneedling radio frequency device that is no downtime, and it just really tightens up the pores, tightens up the skin, and is just shoving collagen into your skin. And I do recommend doing that along with a facial once a month. Pico Focus is also no downtime, no sun sensitivity procedure that you should be doing monthly. Helps collagen, helps with tightening, texture, and hyperpigmentation as well, and is also safe for all skin types and melasma patients. So for me, my regimen these days is looking like medical grade skincare. All of it is on the skin spot. There is a skin quiz you can take as well, which takes about 5 minutes because it's in depth, but it will shoot out products that will work for you. And there's 48 possible regimens that I put blood, sweat, and tears into personally developing. So there's a lot of devices that are amazing now that you can also use from home, anywhere from vaginal tightening to, radio frequency at home.
I have your radio frequency. Yeah.
Yeah. I love it. And I use that on my stomach and on my neck a lot. So I think these days, it's really a combination of, good diet, putting good things into your body. We have the KO products as well. I love the green scoop because God knows there's no way I'm going to get as much greens as I need to. So, it's about putting the right things in your body. It's about taking time to really journal and meditate and really reassess what matters and what the priorities are and what you're grateful for. And then I think it is about a self-care regimen. I think it is about doing stuff at home, and I think it's about doing stuff in the office as well. And all of those things just keep you bright. You hear that nice little compliment, you hear like just people buzzing, and that, you're kind of like not only glowing from the outside, but glowing from the inside out.
Yeah. And I love it too. I really do need to get back to that too. And I mean, if you're going to put the money into like going to a facial, I feel like going into, you have Melanie, who's an amazing esthetician in office. But they're like upgraded. Like you said, like you could do the Pico, you can do the Vivace, which you have been recommending for years. So that says something if she's still saying like, this is it, like, this is what you should be doing every single month. So I need to get on that because I've heard you say that for so many years.
But you know what's so funny, Christine? Like, I haven't been doing it. And then I went to Coachella 2 weeks ago, and everybody's like 2 years old with like perky butts and no cellulite and no skin laxity. And I'm like, holy shit. I had like a coming to Jesus. And I was like, I have all these devices. I'm never more than 4 feet away from
taking the time. That's exactly it's time. You even have the availability. Yeah.
Yes.
Yeah. And yes, I mean, but that's the thing too. Like if you're going to go and do like an oxygen facial or something like that, like sometimes it's okay to just do the little cost and upgrade because
100%.
it's going to be that much more, and maybe skip every 2 months if it's a cost thing. You know what I mean? Than an oxygen every single month. I promise you, I've tried all of this stuff.
So have I.
And it works. Yeah. And to wrap it up too, I do want to say, like, the Morpheus, what you're saying, for anybody that's not heard of it, it is amazing. So it's amazing for the face, but it's amazing for the body too. So for those women who we were talking about body contouring before, but just have the laxity in their skin post baby, or the arms, or we start to see it in the legs. I know I'm seeing all of it. But
and let me tell you, ladies, with the collagen building things, if you can get it in before the age of 45, it will work so much better, and you will be so thankful you did. Because once you hit above 45, then I really have to get into the invasive stuff. And that might be cutting skin. It might be, really high heat with body tight during surgery. But if you can get in those minimally invasive skin tightening devices like microneedling radiofrequency before the age of 45, you will be so thankful that you did.
I'm going to leave it there, because that was one of the last questions I actually had too. Was like, when's our like emergency level here?
Yeah.
Okay. So before you're 45, I know how much time we're in. Dr. Nazarian, this might be our most popular podcast, because truly, even though I'm in wellness, these are the questions that I get all the time. I love it. Let's do your speed round really quick, because you are so busy, and thank you for taking your time with us today.
No worries.
When do you feel your most beautiful?
When I'm in full glam. It's so funny. It's like the wrong answer. I should be like, when I'm being hugged by my children.
No, I love it.
No, like real. Literally, when I get like full glam up at 4:30 in the morning for like 2 hours, nothing.
She gets like Beyonce glam too. She's like, I want these cool braids in my hair. I want like the whole thing. Yeah, she's like glammed on her show.
I literally even considered like hiring a personal assistant that is like / makeup artist, so they could literally do my hair and makeup every morning when I wake up.
Living the Kardashian lifestyle.
Honestly, like literally, it's so funny. I was at like the mall the other day, and like literally I come home and my son was going through TikTok and he's like, Mom, somebody recorded you at the mall and was bragging about what a good paparazzi they are. And literally I could be having like slurping noodles at the mall, and I'm just like, oh my God, like this, I'm a nerd. Like I'm not even like those people. What are they going through? I totally get it.
You're beautiful naturally, but yeah, I get it. I know. Yeah. Same thing. Let's do one more. What is your simple go-to, can't skip in a day healthy habit?
Oh my God, washing my face. I think, and it's so funny because some days I'll come and I know I'll wake up the next day with a pimple if I don't wash my face. And sometimes I'm literally bargaining with God and I'm like, I'm too tired. I'll just wake up with a pimple. I'll take the pimple, God. I got it. But really, I think like one thing that people really miss on is taking the makeup and the sunscreen off at the end of the day. It's like people complain of large pores and people complain of acne. Most important thing, just, wash your face. And get, a retinol on there. And I sometimes even keep it at my bedside.
I've been doing that too. That's the problem, is when I lay down and I've forgotten to put a cream or something, I'm like, I can't get back up, but I know my skin's going to wake up so tight. Like,
I know, exactly.
Yeah. So I started keeping it in there, or like my devices are in my bedside instead of in the bathroom.
Yeah. And there's so many things like I would love to do, like stretching every day.
I know, me too.
And it's just like, I'll do it for like 2 or 3 days and then it'll fall off the wayside because you're just so busy, and the kids and their things and their, but I think there's like so many things I would love to do. I would love to put on a face mask every day. I would love to do my LED light every day. You guys, I even have an entire LED bed in my house. My husband uses it more than I do. Like I could literally be anti-aging collagening my entire skin organ for free, and I don't do it because I should.
Well, I'll borrow it anytime you need if it needs use.
What's yours, Christine? I know you love a lymphatic massage.
I do, actually. I learned that in my last pregnancy. So I will say, it's not my daily healthy habit, but I think it just makes you feel so good. It detoxes you. My greens are truly like my one healthy habit. Like I can go days without stretching, unfortunately, right now with the kids and and work. And I would say I guess washing face, but that one, it's like a non-negotiable for me. I could, excuse me, but be blackout drunk and I wake up with clean face and I'm like, and a moisturizer, and my greens and my collagen, and taking those two things because I just mix them in the morning and drink because I feel so different without it.
Yeah. No, I agree. I think those are amazing products. Like, thank you. Because I never found a collagen that didn't taste like horse.
Plus, it has the ceramides and the hyaluronic acid. If you forget your cream, at least it's doing it from the inside.
So good. So
Thank
good.
You. And dissolves really easily. It's not like
does. You guys, like it's so good. My kids were even taking it. Like, they
liked
it.
Oh, good. Yeah. Thank you. Well, thank you. I mean, this was such an informative episode, as I knew. You're the best. Thank you so much. Where can we find you? Well, we have NazarianPlasticSurgery.com. We have it up on our YouTube right now.
Yeah, where can you not find me? I
literally want us to find you.
I'm like, on Instagram.
Social media.
Yeah, Instagram is probably where I'm most active. And then there's a link tree in the bio, and it'll kind of
Sheila
link to everywhere. The YouTube, the website.
Okay.
Like all
so
of
go
those.
To Dr. Sheila Nazarian. It's SHEILANAZARIAN. It's phonetical. You can
if you just put in DRSH in Instagram, I'll pop up.
Oh, nice. Oh, I like it, girl.
Yeah.
Get it. Top of the top. Thank you, beautiful. I'll be in even before I give birth to this baby to see what I can do, okay?
Come in for a facial. Come to see Mel.
Yeah, I am actually. I'm gonna call right after this.
I go once a month now. It's so good.
Yeah. I can't wait to see you too.
I know, you too. Thank you so much for having me.
Thank you. Bye, guys.
Bye.
Bye. Thank you, everybody, for tuning in. I hope you loved today's episode. Got lots of helpful information on what's new, what's upcoming, how to look natural. But, obviously have a little bit of upkeep too, and pass it along to a friend who's considering surgery. Have questions you need answered? Text me at 1-310-361-8697. Make sure you're following me on social at Christine Bullock, and have a healthy, happy week. See you next time.